All right, let's talk about something so many of us have felt, that super frustrating, kind of mysterious pain in your low back, your butt, maybe even down your leg. You know what I'm talking about, right? It feels like the pain is just playing games with you. Well, today we're going to dive in and give you a real practical guide to figure out what's actually going on. So let's get one thing straight right off the bat. You're not imagining things. If your pain seems to change its address after an injection or some kind of procedure, that is a very real, super common experience. It's not a failure, not at all. It's actually a clue, and that's what we're here to do. Learn how to read those clues. Look, I know you're hurting, and you don't have time for a runaround. So, how do you crack the case of your own pain? Well, we're going to approach this whole thing like a detective story. Because honestly, to get the right treatment, you've got to be the one to gather the evidence first. This is all about turning you into the lead detective on your own case. Okay, so in pretty much every one of these cases, we've got two main suspects. And these guys, they are masters of disguise. They love to mimic each other, which the source material calls, and I love this, pain cosplay. So suspect number one, the side joint or a sacroiliac joint. And suspect number two, the lumbar nerves. You know, the ones exiting your lower spine. Our mission is to figure out who's who. All right, let's do it. Let's officially open the case file on this moving pain. First up, we need a clear profile of our two main suspects. Understanding what makes them tick is, step one to solving this whole mystery. Okay, check this out. This really breaks down our suspects. On one side, you have the SI joint. Think of it as a physical structure. It's where your spine literally connects to your pelvis. The pain it causes is usually this deep, kind of mechanical ache, like a rusty hinge, right? Now, the lumbar nerves, they're totally different. They're like communication wires, and when they get irritated, they don't ache, they send out a signal that radiates. And look at how doctors interrogate them. It's different too. For the joint, they do a targeted SI joint injection. For the nerve, it's a lumbar epidural steroid injection, what you'll hear called an ESI. All right, every good detective needs a toolkit, right? Well, here's yours. We're going to go over 3 key clues you can start gathering right now just by paying attention to your own body. This is how you build a rock-solid case to bring to your doctor. Clue number 1, and this one is huge, the pain map. Seriously, where does the pain live and where does it go on vacation? SI joint pain is famous for setting up shop right in that dimple area, just below your belt line, kind of off to one side. It's that deep ache right in the buttock. But lumbar nerve pain, oh, it's a traveler. It creates more of a stripe of sensation that zips down your leg, and it often goes past the knee, sometimes all the way to your foot. Okay, moving on to clue number 2, the sensation itself. What does this pain actually feel like? Think about it. Joint pain feels, well, jointy. It's that deep ache or a really sharp catch when you move or pivot. It feels mechanical, right? Like something is stuck. Nerve pain is a whole different beast. It's more like static on a radio signal. We're talking pins and needles, burning, little electric zaps, or even a patch of numbness in a really specific area. And that brings us to our third clue, the triggers. What specific actions make the pain scream at you? The SI joint absolutely hates single-leg stuff. Climbing stairs, putting on pants, standing on one leg. And oh, that classic lightning bolt pain when you pivot to get out of a car. That is a textbook clue pointing straight at the SI joint. Lumbar nerve pain, though, it's often triggered by things that compress the spine. So sitting for too long, maybe standing in one spot, or that jolt of pain you get when you cough or sneeze. Yeah, that's usually the nerve talking. So, you've gathered your clues, the map, the sensation, the triggers. Now what? Well, this is when your doctor might decide it's time to interrogate one of the suspects directly. And that's where injections come in. It's crucial to understand these aren't always just for treatment. Sometimes they are pure detective work. So let's be super clear on what a diagnostic injection is. It's a test, plain and simple. Your doctor uses guidance to inject a numbing medicine, an anesthetic, into one very specific, targeted spot. The whole point is to ask one question. Hey, if we numb this one little area, does your usual pain go away for a little while? The answer to that question, it's worth its weight in gold. And this is the key takeaway right here. These 2 injections, the SI and the lumbar ESI, are asking 2 completely different questions. The SI joint injection points right at the joint and asks, are you the culprit? The lumbar ESI, on the other hand, targets the area around the nerves and asks, is inflammation here the problem? See? They're interrogating 2 totally different suspects. Okay, the injection's over. Now comes the really important part, decoding the results. Honestly, this is where a lot of the confusion happens, but it's also where you can find the absolute best clues, even if, especially if, the outcome isn't what you expected. You have to pay attention to the timeline. This is a clue almost everyone misses. The timing of your relief tells a story. So if you feel way better in the first few hours right after the shot, that's the numbing medicine, the anesthetic, and that is powerful, powerful evidence that they hit the right spot. But then there's this weird lag phase. Relief that comes on a few days later and lasts, that's the steroid doing its anti-inflammatory job. The point is, don't judge the whole thing based on day one. Now, this idea is so important. What happens if the pain doesn't vanish, but it changes? This quote just nails it. Maybe that deep, below-the-belt ache gets turned way down after an SI injection, but that tingling down your leg is still there. That is not a failed injection. It's a breakthrough. It's a clue that you might have two things going on at once. You've confirmed one suspect, and now you know you still have to investigate the other one. It's a clean split. All right, so you've learned how to gather your clues, you understand the interrogation process with injections, and you know how to decode the results. So what's your next move? Let's put this all together into a clear plan so you can finally move forward. Before we get to the plan, let's talk about two huge mistakes that can totally derail your investigation. Mistake number one, treating your MRI report like it's the final word from on high. It's not. It's just one piece of evidence. Mistake number two, chasing the loudest symptom. You know, the pain that's screaming the most. Sometimes that's a distraction from the real problem. You've got to focus on the pattern of what's actually stopping you from living your life. So what is the single most powerful thing you can do to change the game at your next appointment? It all boils down to one simple number: 7. Here's your final mission. For the next 7 days, you are going to keep a log. And not just any log. You're going to map the pain, just like we talked about. You're going to nail down your top 3 triggers. But here's the game changer. You are going to track your function. Forget the 0 to 10 pain scale for a minute. Instead, write down, I could only sit for 10 minutes before the zapping started, or I couldn't put my socks on this morning. When you walk into your appointment with that log, you're not just talking about vague feelings. You're presenting cold, hard data. And really, that's what this is all about. You have the power to completely change the dynamic of your next appointment. You can turn it from a frustrating guessing game into a focused, evidence-based strategy session. So the question is simple. When you walk in that door next time, are you going to show up with a guess, or are you going to show up with evidence?